আর সবার নজর রয়েছে যেদিকে, যে আজ মুখ্যমন্ত্রী মমতা বন্দ্যোপাধ্যায়ের সঙ্গে জুনিয়র চিকিৎসকদের যে বৈঠক, এই বাস প্রস্তুত রয়েছে আর কিছুক্ষণের মধ্যেই জুনিয়র চিকিৎসকরা তারা রওনা হবেন নবান্ন সভাঘরের উদ্দেশ্যে। প্রায় 4টে বাজে, অর্থাৎ আর 1 ঘন্টা সময় হাতে রয়েছে। তারপরেই কিন্তু মুখ্যমন্ত্রী মমতা বন্দ্যোপাধ্যায়ের সঙ্গে জুনিয়র চিকিৎসকদের বৈঠক। অনশনের 17 দিনের মাথায় বৈঠকের পর জট কি কাটবে সেদিকেই তাকিয়ে রয়েছে গোটা রাজ্য।
The nonchalance and the inaction from the government and gross negligence on part of the state police made it clear to us that not only the due custody of all criminals involved was of prime importance, it was also necessary to increase vigilance inside hospital campuses and to amputate all elements of corruption within the health system to prevent such brutality against healthcare workers in future. Our initial resistance in form of cease work gained unanimous support from all national and international medical organizations in the common demand of justice and prevention of another such crime at our workplace. In an attempt to pacify the masses at large and to dilute the spirit of the movement, the state government arranged for several meetings with our representatives of WBJDF with verbal promises to meet most of our demands. We returned to work on 21st September 2024, keeping our faith in the administration to fulfill our demands. However, no order or directives were released to gain the confidence of junior doctors, as was directed by the Honorable Supreme Court, and also our emails addressing the state authority requesting the same was also left unanswered. Moreover, false statements claiming revamping of hospital infrastructure and security measures were also made by the Principal Health Secretary, West Bengal, in front of the Honorable Supreme Court. The little that the government of West Bengal did showcase as reformative steps barely scratched the surface of the issues at large and instilled zero confidence in the primary stakeholders. Wounded and dismayed at the tragic state of affairs while being duty bound to our patients, we also faced further incidents of violence and gross lack of security in other medical colleges across the state, where miscreants even threatened to recreate another Abhoya. Furthermore, even patient relatives were not spared from such violence. There was an incident of skull fracture of a patient relative in a state-run premier medical institute. Even after this, we were met with apathy and inaction from the government, who did not release any of the promised orders, with the Principal Health Secretary stooping to the level of blaming the doctors for non-availability of ICU bed and administrative failures, thereby trying to create a rift between the general mass and the medical professionals. The junior doctors felt that rejoining work without extracting our basic human rights and justified demands would just lead to recurrence of such horrific incidents. Despite this, we kept on working. However, this forced us to escalate our movement to the zenith of all non-violent protest forms, an indefinite hunger strike from the 5th of October 2024. 6 of our colleagues have already fallen gravely ill and had to be shifted to the CCU during this course. Even when we were battling with our lives with the sole intention for justice for Abhoya and prevention of another Abhoya, the state government chose to refrain from interacting with us and to stifle our voices, all of our voices of public dissent, by nefarious autocratic measures, including police atrocities and harassment on the peaceful protesters. Enraged doctors and the general public of the nation and abroad voiced their anguish against the authorities, asking for an ultimatum on behalf of the state government in actualizing our legitimate demands. Junior and senior doctors from both government and private sectors unified and gave a call for a Bengal-wide strike of healthcare services on 22nd October 2024, the sole responsibility of which would lie on the ignorance of the state government. What ensued was a virtual meeting of the Chief Minister of West Bengal on Saturday with WBJDF, with the feathery promise of yet another physical meeting today at 5 p.m. at the State Secretariat for open discussion of our demands. For reiteration, we would like to highlight the summary of our demands, which are aimed at 2 main objectives: justice for Abhoya and prevention of any other Abhoya in future.